Neurodegenerative diseases are diseases of the central nervous system, i.e., the brain and spinal cord, which progress and worsen over time. These diseases become more common with age. The three main neurodegenerative diseases are Alzheimer's disease, Parkinson's disease, and amyotrophic lateral sclerosis. Alzheimer's disease is a disease that affects the memory. It is one of the most common memory diseases in France. At the very beginning, it's the immediate memory, the loss of words that can occur as the disease progresses. As the disease progresses, the symptoms gradually worsen, with loss of motor skills and difficulty using everyday objects. For example, using the telephone, managing medication, and this can progress to the point where there are motor problems that create a very high level of dependency. In the early stages of Alzheimer's disease, the symptoms may seem harmless, and we may not realize it, but often the symptoms are similar to those of stress. For example, the loss of words, the loss of immediate memory can be seen in stressful situations. Moreover, in Alzheimer's disease, we know that stress aggravates symptoms, including, as we said, symptoms of loss of words, but also motor symptoms in stressful situations, with patients having more motor problems and being less mobile. We also know, although there are not many studies, that illnesses and stress increase the risk of Alzheimer's disease and worsen the progression of the disease, making it progress more quickly, with patients becoming dependent more quickly. Finally, we know that in Alzheimer's disease, stress and depression are much more frequent than in a population of the same age. We know that stress can be reduced by using elements that are reassuring for the patient, i.e., elements from his life, old elements that can remind him of happy events from his past. Similarly, it is very important to have a pleasant, calm environment, and if possible, for the people working with the patient to be relaxed, even if in certain situations, such as major memory loss or non-recognition, it is difficult to remain calm, but we know how important it is for the patient to have this calm atmosphere. Also, several studies have shown that music therapy, the use of instruments as well as the voice, significantly reduces the patient's stress and consequently slows down the progression of the disease and reduces symptoms when singing, for example, with the patient.